Left neck is worse than right. Gonna get a rib adjustment. Breathe low. All out. Loosen. I think I already got all those earlier. Breathe in the belly. Kegel, roll onto your side, face me. Perfect. All out. Loosen. One more time. Let it go. Loosen.
Oh man. Sorry.
You good?
Yes.
Don't be sorry.
Wow.
Breathe and squeeze. Stay on your back. Take a second. We're going to bend our knees. So breathe in your belly. Expand in your belly. Let go. Good. Breathe into my hand. Keep going. Keep going. Now find your Kegel underneath you. You want to get good at your pelvic tilts. Fill up. Now feel your pelvic tilt. Good. No pain, correct? That was just kind of shocking to you.
Yes.
Do you feel good?
Yeah.
Awesome. We're going to try your rib over here. So we'll cross our arms. Now fix your shoulders in that good posture we were talking about. Great. Now breathe in your belly. And let go. Loosen, loosen. Not today. My table adjusted. You can relax your arms, breathe, squeeze, roll to your side. Just don't bring your traps up to your, don't bring your shoulders up. Back's feeling good still?
Yeah.
Awesome. Breathe easy. All the way out. Good. Breathe easy. And let go. Loosen. Let go. Good. On your back. Too hard?
No, it's okay.
Good. So to breathe low in your belly is how you're going to fill up and activate your core with your belly breath. Think of a balloon that has air in it. You know, if you blow just enough air into a balloon, you're going to feel that tautness on the skin. And that's what we're really looking for with your belly breath. The center of the human being is down low into the pelvis. So you want to fill that area up with air first before you find your Kegel and flex the muscles of your back. One of the most common injuries I see in here is people sucking their belly in, right? They don't find their Kegel and they flex their abs and suck their abs in. And that immediately flexes your back. So sucking your belly in puts our low back into its weakest position. So when you study Qigong, you see professional singers, the first thing they teach them is the diaphragmatic breath, how to breathe low in your belly, getting your diaphragm working to fill up that area low into your pelvis region. In Qigong, they call it your Dantian. It's the ocean of the spirit. It's where we build a ball of energy and qi deep into the pelvis to give us that center of gravity. And then when you add your Kegel to it, you're giving yourself a root. That feels good, doesn't it? Mm-hmm. That deep tissue. Is it too much?
Oh no, I was wondering if that's what you're doing.
Oh yeah, you know I'm trying to release your these muscles right here on the side.
It just normally didn't feel, I wasn't sure if I was just extra sore.
No, you can see your SCM firing here.
I felt it here.
Yep, because I was pushing. Now we're going to work on your left now. So you can see your scalenes. They can probably see it on the video how tight that is. She has a strain sprain on these muscles. So I always work on the opposite side first to allow the body to kind of get used to the deep tissue. Then we go to the side that's actually having the issues. It allows me to get a little bit more on it. This is our second visit in this process. You don't mind me talking about this, do you?
No.
So in this process of treating this strain sprain, I'd say what, 30% better up here? What would you say?
Yeah.
Somewhere around that?
Yeah.
But when I really start pushing on it, that's when it feels like it's not much better, correct?
Yeah.
That's the acute strain part of it. There's still a lot of lactic acid. The muscle fibers are all flexed and don't know how to relax. So we have to, first of all, activate the muscles that were supposed to work. Tuck your chin lightly. Perfect. And then we can release with the scalene swipe. 3, 2, 1. Too much?
No, it's okay.
Good. Tuck your chin lightly. And drop, 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 drop. Now we're going to do both sides at the same time. Tuck your chin lightly. 3, 2, 1. Now that we've released the muscles, we'll go up to the base of the skull. Are you getting any headaches?
Now or at home?
In general?
Yeah.
Yeah. Are they daily? Are they going up to the temples of your eyes?
They're not daily, but they're like every 3 days or so.
Got you. Well, you can tell these muscles right here at the base of the skull, this is kind of contracting on the nerve. This is called the lateral auricular nerve. It leaves right here at C1 and turns into that lateral auricular nerve and then goes deep to the eye and temple. Would you say that's your headache? Mm-hmm. And then I go right to the muscles right here at the base of the skull, and that feels like it's off a little bit? Or does that feel sore and tight?
It feels like I have a headache right now.
Yep, and then it goes away when I let go, right? And then when I come back, it goes right back to the headache, and then it goes away again, right?
Yeah.
So you can take a ball. I take 2 balls and tie them in a sock so I can kind of let each one of those baseballs kind of sit right here, and I'll tuck your chin lightly. Now, activating the deep neck flexors here is going to turn off all the tension here. So when you have that neck injury, we're not only just doing the deep tissue, we're trying to activate the muscle group that was built to work all day, which is your core, your Kegel, your latissimus dorsi on the side, and then finally your chin tuck. Now relax everything. 3, 2, 1. Sorry, I don't mean to hurt you.
Okay.
But without that deep tissue, right, how does your brain ever know to let it go? It'll just keep staying tight. Is that a good stretch?
Yeah.
5, 4, 3, 2, 1. Tuck your chin lightly. Going to the other side. Tell me when it's a good stretch. Say you can go farther on this side. Mm-hmm. Though it still hurts you when we do the deep tissue, we can tell that the left side is definitely the side of the strain sprain.
Yeah.
This is how I'll trick patients into, are they still injured, right? Sometimes they'll get better, they'll tell me they're better, and then I'll show them, you're actually not better. Check out your range of motion from one side to the next. So you're a little off on your upper cervical on the left, so I'm going to start on the left side. I know you're not a huge fan of your neck getting adjusted. So we're going to breathe in our belly, we're going to wiggle our toes, we're going to go to our happy place.
Okay.
And let me get sit on your hands, yep, so you don't slap me. Now loosen up. Good, I got you. So I'm just going to do a little bit of stretching first again. Good. Now, nice and easy, and let it drop, and let it fall. I got you from right there. And there's your atlas. You okay? Mm-hmm. Good. That's going to help with that headache that we're talking about. You don't have a headache right now, correct?
No.
Good. Let it fall and let it drop. Good. This is going to be a little lower, and we're going less. Doesn't need a lot. Perfect. Tuck your chin. That's the answer. Now you get up. We're going to do the whole thing. You're going to breathe in your belly, Kegel, pull your shoulders, and tuck your chin. How do you feel?
Good.
No headaches?
No.
Check your neck. Make sure it feels okay. Awesome. I'll see you next week. Thank you so much. Ice as soon as you get home. Ice in that position with your chin tucked in so you don't get another headache.
Thank you.
My pleasure.